man who has been willing to keep an open mind from the very beginning, but who, after he listens to his constituents, has decided that there are certain things that this country must see when it comes to health care reform. And one of those things is a public option. Patrick Murphy has been in the forefront of this fight, behind the scenes, in front of the scenes, a friend to everyone in the 8th Congressional District who's looking forward to health care reform that really, really makes a difference for all of us, that drives down costs, that ensures affordable care for all of us, and makes the quality of care in this country skyrocket. I'm proud to introduce to you your Congressman Patrick Murphy.
Thank you so much. We appreciate it. Thank you all of us on both sides for being here. Because I tell you what makes America great is the fact that we can all listen to each other. And at the end of the day, we should do what's right for our country and for our fellow neighbors. Let me tell you, and that's what I'm trying to do too, ma'am, okay? So let me tell you, these are several things, 4 principles that I stand for. I talked to a lady who earlier on, I didn't catch her name. She has a sign that's not very nice to me. And I talked to her. And I let her know that there's tort reform in here. And that the Blue Dogs support tort reform passed out of the Gordon Amendment. She says, no, it isn't. She said, man, we're here to talk health care. Okay? And she said, I didn't know it was in there. I said, look on our website. Look, the Gordon Amendment, it passed. And what that does, it says a certificate of merit to make sure that we cut down on the false claims that are out there. Now, again, these are the 4 principles that I stand for because I think it's important. Okay? Ma'am, I listen to you. Please listen to me and be respectful a little bit. Okay? We'll all talk to each other. Number 1, it must be deficit neutral. We all got that. President Obama has said that it's going to be deficit neutral as well. Okay? Number 2, and that has to be agreed upon by an independent body, not Patrick Murphy or Barack Obama. Number 2, if you talk to Cynthia, who earlier, if you're listening to what she said, because her words were very, very powerful. Cynthia talked about her husband, David. She's from Warmminster. She lives in Ann's Choice, one of the biggest senior centers we have in Bucks County. Well, for Cynthia, this is personal. Why is it personal? Because her and her husband are on Medicare, and they fall under the donor hole, which means they live like many of our seniors, or tens of thousands of seniors in Bucks County, and they are on a fixed income. They live paycheck to paycheck. So what this bill does, and it's very important, the second principle I'm going to talk about, is that it finally closes the donor hole. It closes the donor hole because those seniors who paid into Medicare decade after decade after decade have earned the right to make sure that they don't have to choose between groceries and their life-saving drugs. We're fighting for people like Cynthia and her husband David, and I hope to make you proud. The third principle, the third of 4, small businesses. You heard Joe talk earlier about small businesses. 99% of the employees of Bucks County are employed by small businesses. They are hurting. We have an employer-based system. We want to keep it in the private market, the commercial market, and keep an employer-based system. But these small businesses are struggling. They're competing against larger companies and corporations. They're paying for the same exact premium 18% more than large companies and corporations. So what this bill does, and let's be very clear on what it does, it makes sure we reward small businesses for doing the right thing. They get up to a 50% tax deduction for the health insurance plans that they provide their employees. So if it's $12,000, they get $6,000. If it's $14,000, it's $7,000. That's a good plan, and that's the fact of what's in this bill. And the fourth thing, the majority of people who are paying for this, by the way, is the pharmaceutical companies and the hospitals, to answer your question. But the fourth thing, I believe, like many of you in this room, and let's be straight, this isn't taking over government health care. This is doing what's necessary to meet a national challenge. A national challenge that both Democrats and Republicans tried to fix, but they punted it down the street because they couldn't make a tough decision. You're probably wondering why I usually don't bring my daughter to major rallies. She'd rather be doing bubbles. She has her Sleeping Beauty bubbles right now. The reason why I'm here with my daughter is because my wife yesterday went to the emergency room. She's due her second child in 2 months. And they kept her overnight, and I think she's going to be okay. But you know what? I'm one of the lucky ones. All of us in here are one of the lucky ones. I have Independence Blue Cross, Blue Shield. Okay, I pay health insurance. I know, I see the signs. I pay health insurance every month and premium. And I'm going to have to pay copay. But the bottom line is this. I could say, well, I'm covered, and the heck with all my other constituents. That's not what we are in America. Now listen. We need the insurance companies to step up to the table. The insurance companies have been discriminating against our fellow neighbors for decades. They discriminate based on age. They discriminate based on pre-existing condition. So if you were one of the folks that had hay fever 20 years ago, I'm sorry. For many of them, you can't get health insurance, even if you're going to pay for it. Well, no longer, again, as a limited federal government, our role is to be a referee to make sure people are doing the right thing. Otherwise, capitalism runs amok. I believe in capitalism. But there's a healthy role for a limited federal government. The same thing is with the financial sector. In the financial sector, the reason why our stock market was cut in half over a year ago under the Bush administration, I'm not trying to blame names, but that's whose watch it came under, is because we looked the other way and we got rid of all the small regulations. We looked the other way in healthcare for decade after decade. Well, there's a new sheriff in town, and that's not going to happen under our watch anymore. Why is that important? You heard Kathy speak earlier from, we have a B-chip clinic in Ben Sound through St. Mary's Hospital. We have 6 great hospitals in Bucks County. Why is that important? It should be important for all of us. It's not sustainable. Does that mean you change the whole system? No, you tweak it to make it better, to meet this national challenge. Of the 6 hospitals, the one right down the street, the closest to us, is Lower Bucks Hospital, where my wife is right now. Do you know how much they gave last year in free, uncompensated care? $10 million. Not to illegals, man. To fellow Americans, to fellow Bucks Countyans.
That's right.
And you know why that's important? You know that's why it's important? Because they're about to declare bankruptcy. They're going to shut down one of the 6 hospitals in our own community if we do nothing. So for those who are just arguing to keep the status quo, please open your eyes and look at our fellow neighbors. And look after each other. Does that mean you get free care to everyone? No, we can't afford it as a country right now. But can we reward small companies who are having a hard time making ends meet through this economy to do the right thing and provide health insurance? Absolutely. Can we do right by our seniors? To do the right thing to say, I'm sorry, we're not going to ignore you when you fall into a donut hole after you've spent decade after decade putting in the system?
Yes, we can! Yes, we can!
Are you going to go to the insurance companies and say, listen, we're not trying to get rid of you, but we want you to start playing by the rules and stop discriminating based on things like this.
Yeah!